Betsy Stevenson, and I'm an economist at the Ford School of Public Policy. And I've been studying how women's labor force participation has responded and what the lack of childcare has meant. And today I am joined by several of my distinguished colleagues who've been actually also studying this issue from many different lenses. So I'm really excited about today's conversation because I spend a lot of time talking just with economists, and instead today we're going to be coming at this from a lot of different angles and trying to talk about what it means, not just for women's employment, but for their family life, for their mental health, for their physical health, and what this means for different groups of women. Who's getting left behind? Who's at risk of being permanently left behind? So we have a great panel today, and our goal today was to have everybody introduce themselves. So I am going to kick it over to each of you, and if you could just give that brief introduction on how you've been thinking about this issue and the lens that you're coming at it from. And then we'll get through all of us, and then we can start this conversation. But why don't I start with you, Dr. Chavez?
Good afternoon, everyone. My name is Tabby Chavis, and I am the director of the National Center for Institutional Diversity, associate vice president for research, as well as a professor of education and psychology here at the University of Michigan. And today I'm approaching this topic through the lens of the work of the NCID, which is focused on research and scholarship that helps us understand inequality in higher education and society, as well as informed by the work that I've done in my role in the Office of Research, which is focused on the impacts of COVID on our research community, which has a large emphasis on how women and caregivers have been impacted.
Great. Dr. Peitzmeyer?
Hi, I'm Dr. Sarah Peitzmeyer, really excited to be here on this panel. I am a public health researcher and an assistant professor in the School of Nursing, and my research is on gender-based violence.
At the School of Social Work and director of the Parenting and Context Research Lab. And I'm thinking about these issues from the perspective of parenting stress, mental health, and well-being during the pandemic.
And Dr. Jagsy.
I'm Reshma Jagsy. I'm the Newman Family Professor in the Department of Radiation Oncology at the Medical School, and also the Director of the Center for Bioethics and Social Sciences in Medicine here at the University of Michigan. And I have done quite a bit of research on gender equity in academic medicine and had the privilege of serving on the National Academies of Sciences, Engineering, and Medicine's task force on the impact of COVID on women in STEM. I will be speaking here as an individual and not on behalf of that committee, but I will be influenced by what I've learned from that experience and also from doing research to see the impact of this, particularly on the careers of women in academic medicine.
Great. Well, thank you all for joining today. And what I want to do is just start by sort of addressing why we're here, laying the table a little bit, and then letting us dig in together. So, a year into the pandemic, what we see is that this pandemic had a disproportionate toll on women. And from, what I think we want to talk about is the ways in which it's had a disproportionate toll. But let me sort of explain the big econ reasons why it had this disproportionate toll. First, this is our first ever service sector led recession. And women hold more of the jobs in the service sector than men. So we just never had a recession before where women lost most of the jobs from the very beginning. Typically, we see job loss in the goods producing sector. Even though it's a small portion of the economy, it tends to take the real big hit in a recession. And if you want to wrap your head around what I mean, well, normally in a recession, people start cutting back so they don't buy that second deep freezer for their garage. But in a pandemic, everybody wanted to buy the second deep freezer for their garage. But what they didn't do was go to restaurants. They didn't have house cleaning come in. They didn't go out and about as much as they used to consuming services. So we saw in leisure and hospitality in particular, retail sales And even in education and health services, we saw a lot of layoffs, and those disproportionately affected women. I've been calling it the 3-punch for women. That was punch number 1. The second punch was that women started getting called back. You know, the CARES Act put a lot of money in people's pockets. And what we actually saw is people started spending again in May and June. And then, so a lot of people started getting recalled, and people get the call, you know, the dentist's offices are reopening. They call their dental hygienist. They say, we want you to come back in. And they say, well, there's no camp for my kids this summer. I just don't see how I'm going to do it. And the dentist says, oh, that's not that big of a deal. We're not going to have as many clients this summer. You can come back in September. Well, we all saw what happened in September. There wasn't school. And we saw a really big drop in female labor force participation between August and September. And I think that was when a lot of women realized, I'm not going back. I'm not able to work. And we haven't really seen that recovery from that. So that was punch number 2. And then the third punch is that any recession ends up meaning less revenue for state and local governments, and less revenue for state and local governments usually means laying off the employees of state and local governments who are disproportionately women. So that's the situation we're in. Where we're at is a labor force participation rate for women that's back to what it was in 1987. So that's kind of shocking. Now it's a little bit of an exaggeration because that's looking at all adults, and we've aged as a population. If you take a look at prime age women and their employment rate, you know, sort of women between 25 and 54, we're sort of in the mid 90s, early 90s. So, you know, it may not be quite as bad as it sounds, but what we do know is that women have a long labor force recovery. But that's not the only problem. I'm a mom, and I have to tell you, it's been a tough year. It's been a really, really tough year for lots of reasons. So, but what I wanted to start with is frankly not privileged women like me who have had a really tough year. But what I showed in some of my research is that the women who've been hardest hit in this pandemic have been low-income women and women of color, single moms. And they've gotten hit because they've lost most of the jobs. They had much higher unemployment rates. And what I saw in the data is also not just that they lost jobs, but even when they went back to work, they were terrified of losing their job again. Very high percentage of them say things like, I could be laid off again. So losing jobs, they've got kids at home without necessarily anyone to take care of them. So they were between, and yet they need the income from work. So really difficult year. Dr. Chavis, as the director for the National Center for Institutional Diversity, I know you've been thinking about this issue a lot. And I was wondering if you could shed some additional light on how this pandemic has disproportionately affected women of color and women in underrepresented communities.
Thank you, Dr. Stevenson. I think I will reiterate some of the points that you just made. Starting by the fact that one, I'm not a mother, but I think the caregiver, so the role of mother and caregiver, I think hopefully will be a thread through this, because I think in general and in the context of women of color, that is becomes an important kind of set of demands. First, I'll just start by saying, you know, women of color are often positioned at the intersection of multiple barriers that have been both illuminated and exacerbated in the context of the COVID pandemic. The combined effects of barriers related to race, gender, ethnicity, socioeconomic status, sexual orientation, among other areas of identity, life, and experience. While navigating these barriers include navigating systems and institutional structures with entrenched inequalities that already existed. So again, exacerbating existing inequalities and creating new ones has been the function of this pandemic. First, it's been widely documented that COVID deaths have disproportionately impacted communities of color, especially among Black, Latinx, and Indigenous communities, in large part due to structural racism and existing health disparities related to inequalities that impact environmental factors related to increased likelihood of pre-existing conditions, as well as access to quality health care. Women of color from these communities are grappling with ongoing caregiving demands and personal navigation of grief and loss related directly to pandemic losses in their community. which serve as challenges to their physical and mental health. Intensified during the pandemic are also stressors, roles, responsibilities, and burdens related to being immersed in a racial climate characterized by persistent racism, again, intensified by the pandemic. This climate has impacted people interpersonally and structurally, with women of color playing unique roles in this space in terms of their responses and activism in the context of racial unrest sparked by police and state violence against Black and Indigenous communities, as well as the marked increase in anti-Asian hate discourse and acts, which have disproportionately impacted Asian women. And to your earlier point, Dr. Stevenson, these health and social conditions interact with economic conditions. COVID has disrupted industry and economic sectors, impairing the ability of women of color to support themselves and their families, exacerbating existing inequalities. For instance, existing pay disparities. For every dollar earned by white men, Latino women earn 54 cents, Native women 57 cents, Black women 62 cents, white women 79 cents, Asian women 90 cents. And I'll note that even though the Asian women tend to earn the highest wages, there's wide variation across subgroups within that population, with some groups experiencing very large pay gaps compared to others. Women of color are less likely to have the wealth and savings necessary to go for an extended time without earnings, now necessary on a massive scale due to COVID. There's a gender and a racial wealth gap. Even the economic, so this means that in addition to having lower earnings, many women and women of color are less likely to have the resources necessary to absorb and withstand drops in savings and earnings precipitated by the pandemic. The economic rebounds have been gendered and racialized as well. Women of color, as you know, face longer spells of unemployment, and the recent December 2020 jobs report showed that men gained 16,000 jobs while women lost 156,000. And further, but less publicized analysis showed that white women gained jobs in this space while Black and Latino women made up the majority of losses. And again, coupled with the disproportionate deaths and sickness in their communities, which also require economic, which have caused them to incur economic and social consequences. Women of color more likely to be on those frontline jobs. Nursing assistants, home care health providers, grocery store cashiers, domestic workers, child care providers, jobs that are deemed as essential, so women are required to go in the face of this crisis. They may confront higher risks of contracting the virus because of their proximity to infected individuals, environments, or the virus itself. And just a few more data points, they're more likely to work in industries with significant job losses, with fewer workplace supports and protection. So again, to your point about protections from job loss, and have less mobility in jobs and wages, ones that cannot easily be transitioned to remote conditions during the pandemic. And generally across our society, women of color engage in unpaid care work, including childcare, homeschool supervision, emotional support of household members, primary caregiving roles in families, community settings, extended family settings, and unfortunately, these types of caregiving roles for all women, unfortunately, are often viewed as less valuable, less important, and less worthy of respect. In some, COVID has, again, created new obstacles with far-reaching implications. And I will just end, and pass the mic to my colleagues by just noting that our current information and data, I think, are only conservative estimates. There's more that we need to know about the diverse experiences of women generally and for women of color. For instance, family-focused research on COVID impacts would benefit from the greater inclusion of single-parent residential households, which are disproportionately headed by women of color. Most family-focused research in terms of COVID impacts on families focuses on heterosexual couples, a heteronormative approach, which doesn't then fully inform us about queer and trans structures of family and community caring labor, including those with individuals of color. So I think there's lots of information that we know that can help us think about interventions and supports, but also more we need to know.
Great, thank you, Dr. Chavez. I wanted to actually get Dr. Peitzmeier in as you're talking about things like what's happening in outside of a sort of heteronormative, I know that you study trans issues and more generally intimate partner violence and gender-based violence. So I was wondering if you could chime in terms of what you're seeing overall, but also who's hitting the brunt of the impact, or what are some of the issues that you're seeing surfacing?
Thanks. Yeah, and so, I'll take your first question first around trans women. And one thing we know is that 2020 was the worst year on record for murders of trans people in the US. And most of those murders were trans women of color. And part of that increase may be better reporting, but I think a lot of it is probably also due to vulnerabilities that are really being exacerbated in this pandemic. Trans people came into the pandemic with higher levels of economic precarity because of employment discrimination. They came in with higher mental health burden because of discrimination and violence against them, greater lack of insurance coverage, other vulnerabilities like that. And those have really been magnified, right, during the pandemic. We did a multinational study looking at trans women and non-binary folks on the trans feminine spectrum across different countries, and found that about a third reported that the pandemic had reduced their ability to live as their gender, and about half had lost access to gender-affirming medical care. And all of these things were associated with increases in depression and anxiety at a time when half also reported losing access to mental health care. So we see greater burdens in mental health combined with lower access to services during the pandemic that really have placed a burden on trans communities. And I know we're also in the US seeing a flurry of legislative attacks on trans women and girls right now in state houses across the country. So, those are some really big issues that trans communities are grappling with.
Yes, those are huge issues. And I guess I wanted to turn now to Dr. Lee, because we're starting to get into some of the really big stresses that people are facing. And I wanted you to talk a little bit about the mental health aspects of this, and who's been sort of disproportionately impacted by stress and strain during the pandemic.
Thank you. Yes, I think this will echo some of the themes the previous presenters touched on, in that what the pandemic has illustrated is that we're really at a point of a national mental health crisis for all Americans, but especially for vulnerable populations. So my research team and I did a survey very early in the pandemic, in the first couple weeks of after the World Health Organization announced that the coronavirus was a global health pandemic. And this was a relatively small short-term survey, 3 waves of data collection in March and April. And what we found when we asked people about their levels of anxiety and depression was that about 4 out of 10 parents met the criteria for probable major depression or generalized anxiety disorder in those first few weeks after the lockdown. And mothers actually reported more than double the rates of anxiety and depression than fathers. And mothers also had significantly higher rates of parenting stress and economic worries. So this did kind of show a continuation of pre-pandemic trends in the sense that women in general have higher rates of anxiety and depression than do men. But overall, in a subsequent follow-up study, we used a more robust data source, the US Census Household Pulse Survey, which in our case, we used phase 1. This is nearly 600,000 adults, so much more diverse, much more robust source of data over 12 weeks during summer of 2020. And that more robust data source really illustrated similar trends to our smaller study. So anxiety and depression have basically had a 3-fold increase during the pandemic. Interestingly, the data suggested that these rates were not really leveling off. They were actually increasing incrementally over the summer, which is troubling. So what that means is about 1 out of 3 US adults was reporting symptoms meeting the criteria for anxiety. and about 1 out of 4 were meeting the criteria for depression. And again, women were much more vulnerable to these trends than men were. So it was sort of a continuation or an exacerbation of those earlier gender differences that we see in mental health and well-being pre-pandemic, carried forth into the pandemic during a time of enormous economic uncertainty, and many women who are mothers caring for their children at home, facilitating their at-home education, et cetera. So I think that sort of supports the comments of the panelists earlier on in terms of the mental health crisis that we seem to be experiencing right now.
Dr. Jagsy, I just want to get you in on some of what we're talking about right now before we transition to some of the topics you more closely aligned with in your research. But I'm just wondering, in your professional situation, what are you seeing in terms of how this is disproportionately impacting women and women of color? Are you seeing differences in like who shows up for work? Are you seeing differences in the stress and strain that it's taking on your colleagues?
Absolutely. And if you want to hear a really scary statistic, 40% of physician mothers meet the criteria for a generalized anxiety disorder right now. And that's really worrisome because, of course, these are the people that we're relying on for so much of the healthcare provision in our society. So absolutely, those stresses that we're seeing extend to the healthcare environment and to academia. We know that the gendered expectations regarding the division of labor extends beyond the home. So there's been a lot of commentary about how this has been due to the disruptions of childcare and elder care, and that's absolutely true. But it's also true, as you pointed out, that women are in the service sector. And even when you're in academia, we have natural expectations that women will play caregiving roles in the workplace. So we know women are underrepresented in tenured and tenure track roles. In academic medicine, we're more represented on clinician educator tracks. In other academic fields, as you know, women are more represented in contingent positions. And so when we saw education transform to a virtual environment, basically overnight, and students experiencing tremendous stresses, guess who probably did the greater share of nurturing students dealing with all of this and then experienced the secondary trauma that resulted. And in the clinical setting, patients have been experiencing extraordinary stresses, right? In my own case, I'm an oncologist. I see patients dealing with decisions about whether to have visits for tests or treatments, and the incredible stress of knowing that they're at higher risk of adverse outcomes if they contract COVID in the process. And so again, things have been made much more complicated, including by the overnight transformation of clinical care delivery, also to a largely virtual environment. And again, although all academic physicians are facing heightened clinical demands, it's quite reasonable to assume that women have borne the greater burden of this responsibility. So I think we're seeing that play out certainly in academic medicine. And then it helps to explain why you see the differences that we've seen in research in terms of women's productivity, in terms of authorship of academic literature, because they're being drawn into service demands both in the workplace and, of course, at home.
Yeah, so I'm just going to open this up for something for all of you to comment on or think about. But I feel like we haven't seen the end of sort of the detrimental effects of COVID on people's lives. And, one of the things that I fear, I always talk to people who are saying, oh, we're going to get the vaccine and then we're going to all immediately like get up and go out and do our lives the way we did them before, and all the jobs will come back. And like, why is the Federal Reserve being so conservative in saying that they're not going to raise interest rates for, in the next foreseeable future, because aren't we going to have all the jobs back by July? And I'm like, we're not going to have all the jobs back by July. I don't think the pandemic's going to be under control by July. But even if it was, let's just put even aside that premise for a minute. I think that once we're post-pandemic, whether that's July or September or March of 2022, I think that there's a lot of damage, that there's a lot of women in particular who are going to stop and say, okay, I made it through that. I can't do anymore. And I really fear this for physicians, that some of them feel like a real responsibility and, to their profession, to the promises that they made to get people through the pandemic. But once they're through it, might feel like now is a good time to take, some time away from the work or cut their hours. I think a lot of women are going to be in that sort of position. And then I also think from a home life perspective, and so I'd like to get this from the intimate violence, I'm afraid divorces are going to explode coming out of the pandemic, that like there's been so much tension in the household, and that tension has just been sort of simmering. And Dr. Peitzmeyer, you can maybe comment on how much it's not just simmering, but actually exploding. But this is so, I guess I'm asking all of you, what do you think is in our future, even once we get the pandemic under control?
I think what we know about mental health is just because a stressor ends doesn't mean that the trauma just evaporates, right? I see Dr. Lee nodding there. And, I actually volunteer for the National Sexual Assault Hotline. And one thing we've really seen is that since the pandemic started, a majority of our callers are children, because we're seeing this like uptick in child abuse where, children are at home all day with abusive caregivers potentially, and they don't have access to their teachers and their school counselors and the school nurse and their coaches and all these other supportive adults in their life who might be a trusted source of support. And, the escalation of abuse that happens in this environment can be really serious. So, it's certainly hard to get research done safely in these conditions. How do you reach children in homes to do research? We can't. We're just doing service provision right now, but certainly on the service provision side, we're seeing this in our case counts, and our caseload is like shifting toward children on the National Sexual Assault Hotline, certainly. And I think that has the potential to be a generational impact on folks. And then also, women and intimate partner violence. So I think probably everyone saw news articles when the lockdowns were put into effect about, there's going to be a horrifying shadow pandemic, the headlines all said about domestic violence, and folks being locked at home with their abusers all day, and being afraid of going to shelters because they didn't want to catch COVID and shared accommodations, being afraid to go get a sexual assault forensic kit done at the hospital, right? Service providers being shut down. And we did do a study right after the lockdown ended last summer in the state of Michigan, surveying about 1,000 women and trans folks in the state of Michigan. And we found that 1 in 10 reported escalations in IPV. So either they had intimate partner violence in a relationship where that had never been violent before, or there was pre-existing violence, but it got worse during the pandemic. So 1 in 10 reported escalated IPV. And again, echoing Dr. Chavis and what everyone has been saying, that was disproportionately on women who were essential workers. It was disproportionately on women who couldn't afford their rent during COVID and had housing insecurity, women who lost their jobs during COVID or whose partner lost their jobs during COVID. And speaking to that caregiving piece, it was also about 1 in 3 pregnant individuals in our studies reported escalated IPV, which is really concerning, as well as 1 in 4 parents of toddler-aged children. And as someone who has been both pregnant and a caregiver of a toddler during this pandemic, I can say from personal experience that those are really stressful experiences right now, with no daycare and lack of social support and all of those things. And so unfortunately for some of our most vulnerable Michiganders, that increased family strain and family stress has translated into higher rates or higher severity of intimate partner violence. So I do think that we're going to see the effects of this for some time to come.
I also think that the sense of urgency that was quite understandably created by this crisis has led to a lot of fast decision making that unfortunately has then led to deviation from best practices for equity, diversity, and inclusion, and decisions that have unfortunately had disproportionate impact on those who were most vulnerable to begin with. There was a comment that was made in a panel I had done for the National Academies report, where someone said, our leaders seem to be really good at addressing the disruptions that are coming out of the blue that they've experienced. But they seem a little bit less good at addressing the disruptions that they haven't actually lived themselves. And it's not surprising, right? And it's quite likely that women have been excluded from certain important decision-making processes, and people who were appointed to emergency leadership positions have been those who most closely resemble those whom we naturally think are born leaders, right? There are a lot of tall white men running academic medical centers right now, much more so than before the pandemic, because we needed to turn to someone immediately that we could trust. And now is the time, I think, for us to slow down and to think deliberately and engage with those best practices that we've known about before the pandemic, and try to determine the impact of some of our cost savings changes that we've made at institutional levels and academic institutions have really made those most vulnerable, those who are not tenured and on the tenure track, but others who we know are disproportionately women and women of color, really, really suffer here. And so I think that's something to keep in mind as well.
I keep hoping that there's some things that we can learn. I think one in my work in looking at the impacts with researchers and faculty, and, particularly women, like one issue that came up all the time was like the values related to families and parenting are already problematic within the academy. Can we address COVID impacts, but also address the culture of the academy around families? An example is a colleague who said, the first time I was able to talk to my chair comfortably about changing meetings related to childcare was because of the pandemic. Like that made it acceptable to talk about your children and needing to schedule in a way that accounted for your family concerns and needs. Wouldn't it be great if it didn't take a pandemic for that to be an acceptable kind of space of conversation and planning and organizing the way that we do work, since we wouldn't survive as a society without families and child raising. So I think that's an example of people really saying that not going back to normal, but going back to something that helps us learn from some of the things that we've had to engage with the experiences of the pandemic.
So I think that's my biggest optimism of the pandemic, is that it's exposed a lot of weaknesses in our social structure. And I don't just mean like government safety nets. Like the fact that we have no paid leave is almost laughable / cryable in a pandemic, and being the only nation in that situation is just absurd. So obviously we've seen that. We've seen that we are really the only developed country, rich country, to not have universal access to high quality childcare for our children. So those sort of big policies, but also it's just like the structure of of how our employers expect us to operate. We're still operating in the legacy of what was sort of carved out post Great Depression, which involved, a male breadwinner family. And on the government side, 1938, we got the Fair Labor Standards Act because we saw the mess that was the Great Depression. And we said, hey, we need some rules around this. And we got the 40-hour work week out of that. We got the weekend out of that. I saw somebody the other day pointing out that unions should run around saying, unions, we brought you the weekend, right? Because that is what came out of our trauma of the Great Depression. And so hopefully we're going to build something back better coming out of the trauma of the pandemic. But again, I'm going to come back because I want to bring Dr. Lee in on my first question, which is, I think that the trauma of the pandemic and the cleanup from the pandemic is going to take more work than people think. And one of the things I worry a lot about is what happens when we dump these kids back into schools when they haven't been in school, in over a year. And I don't just mean the academic learning, I mean the social emotional learning. So I wonder, Dr. Lee, if you want to talk a little bit about what this legacy of stress will be.
Yeah, thank you so much. And I really appreciated, Dr. Peitzmeier, that you mentioned abused and neglected children, because this is a very vulnerable population and one about which we've heard very little, because as you mentioned, they've been out of school for the most part, and teachers are the single biggest reporter of suspicions of child abuse and neglect. So when you put together the vulnerabilities that children have experienced and their parents have experienced during the pandemic, with their lack of access to education, their lack of access to their peers, and then the fact that I've seen estimates of somewhere between 1 to 3 million kids might be permanently disconnected from education. So not even getting online education, not even getting hybrid education. In essence, many kids have just disappeared altogether. So what is the legacy of that for this generation of children, and how are we going to address that? I think one step is trauma-informed services in school settings for kids who do return to school. We know of many excellent evidence-based practices in school settings to help children deal with trauma and address that both socio-emotionally and for their learning outcomes. But I do hope as a society, we really think carefully about the kids and families who are disconnected at the moment from education, and how we can help to make, first of all, find them and get them reconnected to supporting loving adults and educational services. And I just have not heard a lot about that, at least in my own work, about what we're going to do for those children who are extremely vulnerable.
Yeah, I agree with you. And honestly, that's one of my biggest concerns about rising inequality, is that some kids actually got enormous support, both emotionally and academically during the pandemic, and some have become completely disconnected from academics and from support services. And how do we put these kids back together in the classroom and then expect all to go well? We are seeing a surge in enrollment in private schools, which I think is going to make things worse as we pull the most privileged kids out of our public school system. So I mean, we obviously, there's a lot that's still, this is, an ongoing pandemic, and it's an ongoing crisis, and it's a lot more than getting the jobs back. So I think what I wanted to do now was actually turn to, how do we start to address these problems? What are the solutions to address the gender gaps, the racial gaps, the equity gaps that have either been created or exposed? What are the solutions that we need? You're all silent. You're not supposed to be silent. You're supposed to be chiming in with great solutions.
Well, one thought that I had, and this also harkens back to your previous question about, what are we going to learn from all of this trauma, is something that Dr. Chavis brought up earlier, which is the, racial violence, and that has happened. I know as an Asian American woman, our community is really grieving what happened in Atlanta 2 weeks ago. And, I think some people were maybe surprised by what happened, but, I see the stereotypes that fueled that attack go back to 1875 and the Page Act, when Chinese women were barred to immigrate to the US because we were all seen as sex workers. And that through line has continued throughout US history, not just like popping up suddenly during the pandemic. I think the pandemic has just taken the scales from our eyes around a lot of racism and violence against not just Asian Americans, but other minority groups in the US, of course. I hope that those scales continue to, come down from our eyes, and that recognizing the problem, that, we can continue to grapple with it and make more serious headway on these issues than we have in the past. And it's, really sad how many people of color have had to die for that to happen. But I hope that, we will learn some lessons, at least from that, moving forward.
Dr. Chavis, you looked like you were going to jump in before, so let me turn to you now.
well, my colleagues come in to make me think in lots of different directions, but I would, I guess going back to this, what can we learn about how to not go back to normal, but to create better new normals? I think one of the things that some initial analyses of staff, and I'm speaking within like the higher education academy space, when employees went remote, there some analysis suggested that staff of color, which are disproportionately women, felt not isolation but relief because of not having to navigate daily microaggressions and engagements around their identities, their appearance, that lots of things that related to kind of how people had to have to navigate their racial and gender identities in their workspaces. So, and there's a few other studies that have been burgeoning that show, some similar kinds of trends. So, I worry about, returning to environments where the norms around race have not, changed, where people have already kind of been debilitated and depleted from a stress perspective, and then kind of returning to that space. The other thing that I thought about, again, another example within the academy, is really the need for gender equity focused policies and not gender neutral. So like as an example, everyone should do automatic tenure extensions, was like something I heard over and over again, certainly in the beginning, despite the fact that there is research that, and examples that show when gender neutral kind of automatic extensions have been implemented, that it has, resulted in decreased likelihood of women getting tenure and increased likelihood of men, again, because the implementation didn't account for the fact that women and men who needed the extensions were actually had different demands on their time. And so being able to do extra work that kind of advantaged you, and then the use of a similar post-extension standard for evaluation. So how can we learn to implement policies in ways that explicitly name the inequalities that already exist for women, and then execute those policies in terms of who they apply to, who has access to particular types of supports and resources based on our knowledge of that inequality, versus pretending kind of to start from, an equality space where we're assuming that everyone has the same challenge.
Hey, I love that you raised that, and I'll turn back to you in just a minute, Dr. Jackson. I was just going to say that, I watched this my whole career. I will literally never forget seeing the guy at his computer and being like, wait, I thought your wife was in labor. And he was like, yeah, but the doctor said it's still going to be another 4 or 5 hours. So I thought I'd come and check that my, that everything with my computer, that my files were running. And I was just like, are you kidding me? Like, so, and, I will, when I was pregnant with my first kid, there were 2 men who had wives who are going to have babies around the same time. And I said, oh, well, it's going to be empty here, in September after all our babies are born and we're all at home. And the guy just looked at me blankly and was like, well, man, I'm not going to take more than 2 or 3 days off. And I was like, you're getting the tenure extension just like me. And when I walked out of the hospital 7 days later, I had a very difficult birth. I thought those guys were already back in the office. So, yeah, I'm all for fixing this problem because it's obvious. And then, we've now seen research that codifies everything that I witnessed. And that research shows that those extensions benefit men because they work. And that just creates an even bigger gap for the women who actually do what the extension was for in the first place, which is take care of their children, have their children, nurse their children. Dr. Jagsy, I know you were about to get in on this.
Yeah, I completely agree. And I think getting back to your original point, Dr. Stevenson, about the durable impact of this, right? We've seen disruptions in productivity and academic productivity, particularly early on in the pandemic in terms of women's share of authorships. And that may be a temporary hit, but we all know that if you don't author a paper, then you don't get invited to write editorials, you don't gather the pilot data for your grants, that there is a substantial risk of long-term impact of even a short-term hit. And I don't even think it was a very short-term hit, right? And the real challenge here is coming up with innovative policies that actually allow acknowledging what the disruptions of the COVID pandemic were, right? The idea of adding COVID impact statements to people's tenure packages so that you can actually explain why you needed that extension related to COVID. And was it that you were drafted full-time into clinical care and had kids at home, or was it actually that you had a lot more time to do research? And of course, no one's going to write the COVID impact statement saying, hey, I had a ton of time to do extra research. But I do think that there's something to be said for those types of interventions. And again, we have to innovate and we have to evaluate, because this is a situation where the National Academies came up with a whole report that was released in February of last year, right? February 2020. The National Academies released promising practices for promoting the careers of women and other groups that are underrepresented in academic STEM. And then the pandemic broke out. And so unlike most National Academies reports, it didn't get a ton of attention, but it gave us practices we know are likely to improve things in the pre-pandemic context. And those innovations need to be evaluated in the post-pandemic environment. So I think we have some good hypotheses and ideas out there. And what we need to do now is study their impact, because we can't assume that those gender neutral things like extending the tenure clock, especially with the study in economics that showed that it does exactly the opposite, are going to actually help to mitigate some of these disparities.
I think one of the challenges is that some of those solutions, like, have women write, an impact statement, they're putting the burden back on women. And so, how do we design solutions that put the burden on the people who are least burdened?
Yeah, pick your 6 best years. I like that one, right? Pick your 6 best years or 7 best years or whatever you want to say. And so if you say that there was a disruption due to childbearing or due to a pandemic, now it's hard because, of course, like somebody like, well, where do you draw the year boundary? But in any case, there may be some policies like that where you say everybody gets a certain number of years of productivity that they're judged on. Again, doesn't get at the fact that people may have stepped back halfway. And so it's challenging, I think, to do this, but I think we have to do something.
Yeah, and I mean, particularly in economics where there are, real publication lags. So, you could have half your publications hit in 1 year and you'd be like, that's my year. Dr. Lee, do you want to jump in on this conversation just in any way, shape, or form? It's now totally free flowing.
Well, actually, I was sort of going to shift gears. I mean, when you asked about policies, I was thinking of policy for children and families and how slightly optimistic I am about the Biden-Harris moment where we might see sort of a New Deal, maybe, that really does address some of the shortcomings in terms of childcare, lack thereof for American parents, and hopefully continuing some form of subsidy, whether it's through a tax credit or through, monthly stipends or to parents who had children, and what an enormous benefit that would be to especially vulnerable families, poor families, to be able to meet their children's needs. And actually, research shows would reduce child abuse and neglect if we were able to provide those kinds of supports to families. So that was my solution, my response to your solution, somewhat of a non sequitur from the discussion of the academic environment, but.
Oh, but I'm glad you brought this up. I mean, we just saw, an extraordinary package get passed, the $1.9 trillion, which was really a lot of money for 1 year for ending child poverty. And, of course, that's the way the US government operates, that we're going to end child poverty for a year, and then we're going to throw those kids back into poverty at the end of that year. But, the hope is that our government gets so stuck in, whatever we're currently doing that they then end up passing that forever. And then otherwise, us academics get to sort of figure out what did happen when we gave kids a ton of money. But that I will tell you, though, and this actually is shifting a little bit to one of the questions from the audience. One of my concerns is that I would like us to focus a little bit more on kids and what kids need. And the focus seems to be on mothers. And so when it comes to we need more childcare, it's for mothers. Instead of early childhood education, build stronger kids who grow up to be stronger adults. And one of the audience members said the solutions have generally driven a wedge between women with children and those without, and between women in different roles. And so the audience member asked, could you address some of the ways we can support all women going forward, regardless of their role and child status? So my answer to that is partially that we need to be focusing on children as what children need, and less so on necessarily what mothers need. And we have to be very careful that we don't do things that end up moving women back to the 1980s permanently by, say, paying them to stay home, giving them a subsidy to stay home. But if we're focusing on children, then we're supporting all children regardless of what their parents are doing. You know, we should see early childhood education as a right of the child, not the parent. But what do you all think? What are are you seeing this problem of driving a wedge between women with kids and women without? And what do you think we can do about that?
I mean, I guess I would add to that. I mean, I started out by saying, you know, what my identity was, because I have heard that, and I guess I've tried to be very intentional about describing when I'm talking about women, like what areas I'm speaking of, because there is a space to talk about motherhood and children, but there also, if we look at our society and the social construction of gender, you know, that women take on lots of different types of caregiving roles, extended family, dependent community kind of care that literally like is upholding communities in our society, that are disproportionately kind of impacted in the COVID space too. And so just making sure that that doesn't get lost in the discussion, so that it's like women and mothers are not, you know, synonymous in that way, or exclusive in that space. But I think we need to name the issues that we're trying to work on. If we're talking about mothers and parents and caregivers, then we need to name it. If we're talking about the other ways that women, for instance, the disproportionate type of mentoring and advising and caretaking that in the academy and out that women are likely to do, then we need to name those, because the solutions will vary depending on what areas that we're naming.
I think it's also I was gonna say, I think it's also important to focus on women outside the gendered expectations to caregive in the broader sense, but to think about the other things that unite women in being marginalized, right? We know that even before the pandemic, issues like overt discrimination, harassment, incivility, unconscious bias, those all existed before. And I can't remember which of you said it, but I loved the way you put it, which was illuminate and exacerbate. But, you know, right, that this pandemic has both illuminated and exacerbated these challenges that unite all women, regardless of whether they have children or whether they're caring for anyone other than themselves. And so, you know, that tremendous incivility, I mean, look at what we're experiencing right now about senior female leaders in our state being likened to witches, right? Those are things that affect all women, and that level of incivility is unacceptable. And so I think that's also something that we need to come together to address.
And I also want to challenge the framing of the wedge, right? Because who does that framing benefit, right? This is like, you know, and the patriarchy is invested in making women feel like we need to fight each other for scraps falling from the table, versus looking to like who's holding the power and how do we make things more equal for all women, as my colleagues were just saying. So just questioning when we hear these messages or these narratives, like where are they coming from, who are they benefiting, and how can we resist them and flip that narrative so that we are working together.
Dr. Lee, do you want to jump in?
Well, I would just say, and if you even take that conceptualization one step further and you think of children as independent entities who have rights and who are deserving of protections and benefits and who are themselves vulnerable, you're actually kind of addressing the wedge by situating the benefit in the child, not in the adult, which I think is what you were saying, Dr. Stevenson, but that just echoed for me.
Yes, so that's definitely where something I think is really important. You know, one thing that I think a lot of people don't realize, because we've heard so much about declining fertility in the United States, is if we look at women's completed fertility had actually been rising for about the last 15 years. And so when we think about like driving this wedge between women who have kids, women who don't have kids, there are some women who are never going to have kids. But I think all women are going to be caregivers of some sort. And I think, Dr. Chavis, that's one of the things you've been saying, like, let's just not talk about just childcare, but there's elder parents, there's loved adults, there's lots of people in your life. So everybody's going to be a caregiver. And also a lot more women are going to be or have been mothers than are currently with small kids at home. And so what we saw in 2019 was the highest labor force participation of women with young kids that we'd ever seen before. And we saw women's completed fertility being at levels we hadn't seen in the 21st century before. But what we were seeing was women in their late 30s and their 40s with 2 or 3 kids under, 10 at home. And that's because women are having kids at much older ages. That's why we keep seeing the annual fertility rate going down, even though we're seeing for a generation that their fertility is higher than the generation before them. Fewer women who are currently in their 40s have never been a mother compared to the generation above them. And so, it was sort of a great time for fertility, a great time for working with kids. And yet all these mothers also had a ton of experience. So some of the fakeness, I think, of pegging women against each other is you have a lot of women in their 20s and 30s and maybe even, early and mid 40s who just haven't had kids yet, but may eventually have kids. So I just don't think we should be in the business of saying who is a mother and who isn't a mother, because, we don't know when that status could change. So that's another way to think about it. Another question we got is, I'm going to ask this, even though I think we've sort of talked about it, but it's actually asked in a really interesting frame, which is, do you have ideas for nudging the system to care about what women need? Like, are there subtle changes we can put in place that would get the system to care more about what women need?
More women leaders in it. Given what we just saw about the disrespect of women leaders, so that, the women are not a monolith, but I think the more diversity of women that we have in spaces where people then will stop and say, this policy that we thought was person neutral, has implications for members of, my gender group or others in my community or families or communities in ways that women, are socialized, and traditionally kind of pay attention to, again, through the socialization and the roles that we play. So that's one structural vector. It's not the only thing. Who participates as leaders and kind of within the system matters.
What about the ways in which we get care for kids? I've gotten asked this, so now I'm just going to ask it to Dr. Lee and Dr. Peitzmeier. We rely a lot on the school system to be the trusted adults that make sure that if things are going wrong for kids, that kids get fed, that they have somewhere to report in if it looks like there's child abuse. Has the pandemic exposed that to be a problem, or is the problem that we didn't have a way to keep that connected? Like, what do you think about that?
Well, I think in my mind, the pandemic has shown us that system doesn't work very well for vulnerable kids in particular. And so I guess my hope moving forward is that we do think about a more robust system for caring from children from birth, ideally, through their early childhood, so that they're touching more systems and touching more systems that aren't stigmatizing systems like a CPS type of system. So, as a social worker, that type of model, more of a public health approach to taking care of kids, resonates with me, but and maybe that will be something we see in policy reforms with the Biden-Harris administration.
Yeah, we know that caregiving is really undervalued in our society, and that means both in the home as well as like our public schools have never been funded properly, right? And they don't operate the same way for kids of color as it does for white children, right? And so I think illuminate and exacerbate exactly is the word of the day. I think this has really exposed a lot of those inequalities even further, and thinking about, as we go back to school, teachers are in caregiving roles and have not been prioritized for vaccinations and things like that are needed to go back to school safely. And so how do we increase our investment in those systems to make them work better for all of our children moving forward is a really important question that we need to take more seriously.
Well, I think as sort of down of a note as that is to end on, I think it is actually the right note to end on, because I think it's exactly, where we're at. It is now 5 p.m., so we're out of time. And I want to thank all of you for joining in and taking the time for this crucial conversation, and everybody who joined in today. I really learned a lot from each of your insights. And so thank you for coming together so we could have this conversation.
Thank you.
Thanks to everyone.
Enjoyed it.
Thank you.